Here we'll talk about Adolescent Health Program. It is a part of RMNCH+A program. So the plus A denote Adolescent Health Program. It mainly focuses on nutritional, sexual health and reproductive health, mental health, substance abuse, gender-based violence and the non-communicable diseases. So these are the key areas which this Adolescent Health Program focuses on. So it is operated at 4 stages. One is the individual, then at the family, then at the school and the community level, right? So we have 5 interventions. The first one is about nutrition. Here we'll provide iron and folic acid supplementations weekly. So weekly iron and folic acid supplementation, also known as WIFS. Under this we'll provide 100 mg elemental iron and 500 mg folic acid. And also we'll screen the target population like pregnant women and adolescent females because they are more prone to anemia, right? And deworming program can also be done where they'll provide 400 mg of albendazole 6 months apart, right? So they are providing 400 mg of albendazole 6 months apart because even the hookworms will lead to anemia, right? So deworming program can be done to treat any anemia causing by hookworms. And information and counseling can also be given. Coming to the next one, which is facility-based ARSS services. So ARSH means Adolescent Reproductive and the Sexual Health Services. From the name itself, you can understand we are providing information or the services about sexual health and the reproductive health, right? So under this, we'll provide counseling on this contraception, reproductive tract infections, childbearing, delayed marriage, contraception, abortion, mental health problems, substance abuse, sexual abuse and all, right? So let us see what is actually happening here. Under this facility-based ARHS services, we are conducting 3 things. One is we are setting up clinics, and in the clinics we'll set up some counselors who will counsel people about the importance of sexual health and all. And then we'll do outreach activities like we'll go to schools and colleges, we'll teach them about the sexual health and all. So what is happening here? First, we are opening a clinic. In the clinic, there are some counselors who will counsel people about the sexual health and all. And also some of the counselors will go out and teach the people about sexual health and all in the colleges, schools and clubs and etc. So that is outreach activities where the counseling is done within the clinic is called like facility based counseling. And these clinics are called AFSH, which is Adolescent Friendly Health Clinics. Right? So here existing hospital will be converted into fixed day facilities. So previously in hospitals they did not give much importance about this adolescent reproductive and sexual health, right? Nowadays we are opening a room or separate clinic in that hospital itself for this adolescent reproduction and the sexual health. That is known as Adolescent Friendly Healthy Clinic. So existing hospitals are getting converted into fixed day facilities. We have provided information and the services for more than 2.5 million people using this AFSH, and it mainly focuses on contraception, menstrual problems, ANS, STDs and anemias, right? So in these clinics we have kept some counselors, right? So total 881 dedicated counselors are participating in this program where you can see facility based counseling services are being given to the people where they'll teach about this nutrition, puberty, RTD and sexually transmitted diseases, contraception, delayed marriage, childbearing, abortion, mental health problems, substance abuse and the sexual abuse. So they are providing education about the sexual health. And outreach activities means you are going out to schools, colleges and teen clubs and providing information about the sexual health to the people, right? So this is about this facility based ARSS services. Let us see the third intervention, which is about menstrual health. So here we have a menstrual health scheme. Under this, community health education is given to 10 to 19 years of girls. The target group is 10 to 19 years under this menstrual hygiene scheme. So we are going and giving them education about this menstrual hygiene. So first of all, we'll train all the ASHAs and the nodal teachers about the menstrual health, and then we'll make available storage and distribution of the sanitary napkins, and also we'll teach them how to safely dispose the napkins. So what are we doing under this menstrual health scheme? First of all, we are educating them. The people who needs to be educated is 10 to 19 years of girls, right? And then we'll train the teachers present there like ASHAs and nodal teachers to also educate them, and then we'll provide them sanitary napkins. Afterwards, we'll also explain them on how to safely dispose the napkins. Coming to the fourth one, information counseling on adolescent health, sexual reproduction and other health issues. So obviously we are providing information and also counseling on these topics. Preventive health checkups. So we are also conducting these health checkups to prevent any complications of this sexually transmitted diseases or any other diseases. So this is about adolescent health groups. So if we summarize the whole thing, let us just quickly rewind this interventions. First one is about nutrition, weekly iron folic acid supplementation, 100 mg iron, 500 mg folic acid, screening the target population, deworming can be done. And the second one, facility based ARSH, where you are opening a clinic which is known as AFSH, Adolescent Friendly Health Clinic. You are keeping some counselors. They will teach the people about the sexual health, and also some go out and teach in the schools, which is known as outreach activities. And then menstrual hygiene. First of all, you are educating the girls of 10 to 19 years, and then you are also training the ashas and nodal teachers to educate them. Then you will provide the sanitary napkins. You will also explain how to safely dispose them, right? And the last 2 points are, you will provide information and counsel the people about this adolescent sexual health, and also you'll do preventive health checkups for any non-communicable diseases, or also for any STDs and all, right? Because under this program we are also covering this non-communicable diseases, gender-based violence, nutritional disorders, or any sexually reproductive tract diseases, right? So mental health also. So we are covering every disease, almost all. So here also we'll do this preventive health checkups for these diseases. That's it. Bye.